Welcome to Lesson 23, the nervous system. In this lesson, we will examine the brain, spinal cord, and peripheral nerves. We'll also explore common disorders, effects of aging, the QMA's role, and medication classifications used to treat nervous system conditions. By the end of this lesson, you'll be able to describe how the nervous system functions, recognize disorders like seizures, Parkinson's, and MS, and understand medications and the QMA's care responsibilities involved. The nervous system has two parts, the central nervous system and the peripheral nervous system. The brain interprets information, the spinal cord carries signals, the somatic system controls voluntary movements while the autonomic system handles involuntary movements like heart rate and digestion. The brain, which weighs about 3 pounds, is the command center for the body. It's responsible for thinking, memory, speech, movement, and more. The spinal cord extends from the brain and carries messages throughout the body. Nerves are bundles of fiber that carry messages to and from the brain. Some control voluntary muscle actions while others operate automatically, such as heartbeat and digestion. There are 43 total nerve pairs coordinating body functions. As the nervous system ages, nerve impulses slow down. This causes slower reactions and affects memory, balance, and coordination. Older adults are at higher risk for falls, strokes, and neurological conditions due to these changes. Seizures occur when the brain's electrical system malfunctions. Some seizures are mild and barely noticeable, while others involve loss of consciousness or violent shaking. Epilepsy is diagnosed when seizures are recurring. A stroke or a cerebrovascular accident happens when a vessel in the brain is blocked or burst. A TIA or mini stroke is a temporary blockage. Symptoms include confusion, slurred speech, numbness, weakness, especially on one side. Parkinson's disease is a progressive disease caused by low dopamine in the brain. It leads to tremors, stiffness, slow movement, and shuffling gait. People with Parkinson's may have difficulty speaking clearly or writing legibly. Michael J. Fox is a popular actor that has Parkinson's. He would be somebody to Google if you wanted to see what it looked like. MS, or multiple sclerosis, is a disease in which the immune system attacks the protective covering of nerves. This disrupts communication between the brain and body. Symptoms vary, but often include fatigue, numbness, and vision problems. MS may go through periods of flares or remission. Head injuries may result in brain swelling or bleeding and long-term memory or speech issues. Dementia and Alzheimer's are common in aging adults and cause progressive cognitive decline. Neuropathy, often related to diabetes, causes pain or numbness in hands and feet. QMAs must observe for early signs of neurological issues such as tremors, confusions, or slurred speech. Document and report any seizure or loss of consciousness. Always ensure safety during transfers and assist with mobility. Medications include anticonvulsants for seizures, dopamine-enhancing drugs for Parkinson's, and drugs that slow cognitive decline in Alzheimer's. It's important to note that the Alzheimer medications, it's not going to reverse anything, it's just going to slow the progression of the disease. Typically, you'll see an initial benefit of it, but it doesn't last long, typically 6 to 12 months. While these medications may improve memory for a little bit, thinking, mood, their effectiveness diminishes over time. Pain medications may be used to help with neuropathy. It's important that the QMAs must report side effects like drowsiness, dizziness, and agitation to the nurses.